Banner has dedicated substantial resources to preparing for the H1N1 potential pandemic over the last several months since its original outbreak last spring. It's all addressing the safety of our employees, our patients, their families, and visitors. We've established an emergency operations committee at a system level and have established also leadership teams at each of the facilities to address this issue. As part of our effort to assure the safety of our patients and employees, we have established an emergency operations center here at the corporate center in Phoenix to address the H1N1 pandemic. That group is made up of representatives from human resources, medical and nursing leadership, finance, and others in place there. A large portion of that group are also nurses. Additionally, we have facility-based similar organizational design that include also nursing, medical leadership, operational leaders, and so on. Banner's taken a whole host of actions to address this potential pandemic. We have adopted guidelines as recommended by Centers for Disease Control, World Health Organization, and others on how to best protect both our patients, employees, family members, and so on. We have established and implemented visitor restriction guidelines for folks of a certain age group not to be visiting our facilities and thereby reduce the likelihood of spreading the infection. We have encouraged all of our employees to obtain a vaccine, both the injectable and the flu mist variety, and as supplies become available, we'll want to have as many of our employees vaccinated as possible. We've actually established, by working with our suppliers, an increased supply of those items that we're going to need in order to manage this pandemic, including masks, various other protective devices, and so on. And then finally, we've established some policies that we really encourage our employees to stay home when they're sick with a fever and not to return to work until they're well. In fact, we've actually adopted and suspended a disciplinary attendance practice that is ordinarily in place until the flu episode is over. The H1N1 vaccines are produced in exactly the same way as the regular seasonal flu vaccines are manufactured. We have many years of experience with that. We have clinical trials demonstrating both their efficacy and their safety. They've been overseen by the National Institutes of Health and by the vaccine manufacturers themselves. Clearly, obtaining a vaccine is the very best strategy to avoid this illness, and we are all much better off by having the vaccine both individually and on behalf of our family members as well. Besides obtaining the vaccine, the most important thing you can do is wash your hands. It substantially reduces the likelihood of transmitting this virus to folks that you're near and family members. Second of all, when you're going to cough or sneeze, use normal droplet precautions. Cough or sneeze into a Kleenex. And then third, the normal types of precautions when you're involved in patient care, including the wearing of masks when involved with patients with fever and respiratory illnesses.